For people who are suffering from cancer, the COVID-19 pandemic adds an extra layer of worrying and concern, not just for patients, but also for their families and caregivers. The first question is, how do patients or cancer survivors protect themselves from COVID-19? The chances of getting infections are higher for cancer patients because of their weakened immune system. On the program today, we'll talk about how cancer patients can reduce the risk during this continuing pandemic. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, your partner in healthcare. Most people who get COVID-19 will have mild to moderate symptoms. But if you have cancer and get the virus, your illness can be at risk of being more severe. To talk about this and more, we have Dr. Rachel Rosario. She's the Executive Director of the Philippine Cancer Society. We also have Dr. Augusto Jose Galang. He's a gastroenterologist and President of the Philippine Society of Gastroenterology. Thank you both for being with us on the show today. Now, infection is one of the most common complications of cancer as well as cancer treatment. And this is because both can weaken the immune system for a period of time. Some infections can spread to other parts of the body and be life-threatening if not detected early. Dr. Rosario, let's talk about this some more.
Your immune fighting system can be affected, like if you have lymphoma or if you have leukemia. And of course, if your cancer has metastasized to the bones, then perhaps your bone marrow can also be affected by the cancer. Hence, this will result in a lower immune system. On the other hand, there are also treatments which can affect this.
Okay, now, Dr. Rosario, can being treated for cancer, or if someone is being treated for cancer, are they automatically at higher risk of having other infections?
There are treatments now like radiation or chemotherapy or even bone marrow transplants that can really bring down the immune system. So there will be an increased risk for infections to set in.
Dr. Galang, what is the impact of cancer treatment on the body over time?
Aside from surgery, when we offer chemotherapy or radiation therapy, then we also affect the normal cells. So as far as we are targeting the abnormal or tumorous tissues to kill the cancer in general, however, we can also affect the integrity of other normal cells. So as much as possible, we limit this collateral damage, and as much as possible, we offer targeted treatment, especially with regards to radiation therapy and even to chemotherapy.
Now, patients always want to know if they are able to have a normal immune system function even after treatment. Dr. Rosario, does being treated for cancer make you at risk for developing severe symptoms of COVID-19?
Well, it depends on if you're having the treatments for the time being and if your immune system is quite weak during the time. We have to remember that after treatment, though, the immune system will also recover. So, included tayo dun sa mga patients with other comorbidities wherein if COVID will be present, there is an increased risk of the more severe type of illness that can affect the body.
Now, chemotherapy is a type of treatment for cancer, but they can also weaken a person's immune system, leaving you vulnerable to infections. However, it's still important to participate in activities you enjoy and live your life as normal as possible. Dr. Galang, what happens when a cancer patient develops an infection?
Oh, okay. Because we consider all cancer patients are as immunocompromised patients, even simple infections can become uncontrolled and may develop into severe forms of infection. That is why the most important for them is to avoid exposures to patients who are sick and at the same time protect themselves from getting infected.
And since it's important to treat infections quickly when receiving therapy, it's helpful to know what symptoms to watch out for. Dr. Galang, what symptoms should alert someone that their body is reacting to more than just the cancer treatments?
Okay, in general, fever is a very common response of the body to any foreign exposure. As definitely when we have infection, we develop fever, but also we develop other constitutional symptoms like body weakness, or it depends on which particular organ or site of infection there is.
Dr. Rosario, what can cancer patients do to protect themselves from infections?
We have to look at the diet, eat well, eat nutritious food, and then of course have some physical activity, and the usual that we do, hand washing. And during this time of pandemic, it would be useful really to wear a mask or a face shield when we are going out, and maintain the 6 feet distance, or at least 2 arms length away from other people. And we will have to try to stay at home for most of the times, unless we have to go out to do laboratories or maybe go for treatments.
That's right. That's good advice. Now, colon cancer is the third leading type of cancer in the country, and we'll discuss more about this type of cancer when we come back. You're watching MedTalk Health Talk here on CNN Philippines. Colon cancer usually affects older adults, but can happen at any age. It usually begins as a small clump of cells, but over time, these can develop into colon cancer. We're Together in Health. I'm Dr. Freddy Gomez. Colorectal or colon cancer refers to the uncontrolled growth of abnormal cells in the colon or rectum, which are part of your digestive system. Dr. Galang, can you please explain how this cancer forms?
Well, colon cancer, as in any other forms of cancer, is an abnormal growth of tumorous tissues in our body, particularly involving the large intestine. How does it develop? Normally, it starts from a tiny or a small polyp that would, in time, grow into a bigger size of tissues to form a large tumor or a bigger tumor.
Colon cancer usually doesn't exhibit signs in the early stages, but it is possible. Dr. Galang, let's talk about the possible symptoms during the early stages.
As in most cancers, usually early cancers develop no symptoms or produce no symptoms at all, such that patients may not feel any symptoms. However, we have to be aware of several symptoms that may suggest an abnormality in your colon. Like, for example, if there are any changes in your bowel habits. One more thing is, some people will be able to pass out regular formed stool daily, for example. However, the patient may notice that in the past few weeks, he or she has not been able to produce a formed stool. Of course, patients may also develop rectal bleeding or passage of fresh blood per rectum. Now, that is a little tricky because there are other causes or medical conditions that can produce rectal bleeding, the most common of which may be hemorrhoids. However, we would like to remind or inform our countrymen that an abnormal passage of fresh blood per rectum merits a medical attention so that we could possibly rule out more serious conditions other than hemorrhoids, and then may develop symptoms related to anemia like body weakness or easy fatigability. Now, weight loss could also be a symptom. However, we don't expect symptoms to happen early in the course of cancer in general. That is one of the cancer signs that we would like to tell our patients to.
Now, Dr. Galang, do we already know the cause of colon cancer?
Cancers in general, we do not know the cause. However, we are able to identify several risk factors that increase your chances of getting colon cancer. Among them is an advanced age or increasing age. Patients who are more than 50 years old are considered at higher than normal risk of developing colon cancer. Those patients who had previous history of polyps or even previous history of colon cancer may still run the risk of having another colon cancer. Now, patients may have some family history of colon cancer We have heard that low fiber and high fat diet and even sedentary lifestyle can predispose to colon cancer.
Yes, that's right. And many lifestyle factors actually increase one's risk of colon cancer. So these are risk factors that can be minimized with some healthy lifestyle changes. Diet is one of them, right? But Dr. Rosario, ano pa ba yung ibang mga risk factors na dapat alam ng ating mga viewers that may predispose them to not just colon cancers but cancers in general?
I guess you mentioned initially diet. So we need to concentrate on what to avoid, no? And we will say, please avoid a diet that is high in red meats and processed meats. There are chemicals there, and these preservatives can affect, no? Whatever structures are in the meat that we are eating. We also have to remember that cooking at very high meat or rather high temperature, like frying, broiling, grilling, this can also result in some changes, no, that can also predispose or increase the risk for colon cancer or even other cancers if we do consume a lot of this. So we try to tell our patients to please go for more vegetables, more fruits, and of course, the other things that we have to remember will be more active. We also have to remember again that we need to drink in moderation, and of course, smoking is really the enemy of all cancers.
It's rare for colon cancer to exhibit early symptoms, but thanks to routine recommended screenings for people 50 years old and older, colon cancer are among the most preventable. Dr. Galang, please describe to us what goes on in a screening test.
That's a very important question, Freddie, because we would like to influence the public to have this kind of behavior to be aware of their digestive health. For example, let us protect ourselves from colon cancer. We have several ways to screen patients from colon cancer. The most simple is the use of a simple stool exam that will detect for the presence of abnormal blood in your stool. We call the test fecal immunochemical test, or FIT. It is recommended to undergo FIT at least annually, okay? Because if you become negative for that, then it doesn't rule out you will not develop colon cancer. It will just say that the risk is less, and therefore you may need to undergo another FIT test the following year. Now, the other tests that we recommend is colonoscopy, because during the colonoscopy, we can identify polyps that can harbor malignancy, or if not, they can potentially become malignant in the future.
Colon cancer is more often than not curable when detected in the early stages, and the treatment needed would depend on your situation, including the cancer's location, stage of the cancer, and other health conditions for that. Now, what kind of treatment is usually done for the early stage of colon cancer, Dr. Galang?
During the early stages of colon cancer, we offer surgical excision, a surgical resection of the colon. If we would like to be practical about it, okay, among the digestive cancers, because of the colon's length, we can remove a segment of the colon to remove the tumorous tissue, and therefore we can cure these patients in the early stages. However, beyond the early stages of colon cancer, aside from surgery, we offer other forms of treatment, like chemotherapy or radiation, as the case may be, especially if it involves the rectum.
Now, Dr. Rosario, what can we tell our viewers about the more advanced stages of these cancers?
The medical oncologist might still have other treatments to give to the patient, but we are now going to focus more on quality of life for this patient. Don't you agree, Dr. Galang?
Right now, it's good for us to offer these forms of treatment or management to patients in the advanced disease. We may not be able to, save everyone, but at least we can be able to provide better quality of life.
People with cancer are faced with the dilemma of increasing their risk for COVID-19 while undergoing cancer treatment. But how can you stay safe while being treated for cancer? Don't go away. We'll have more on this when we come back. You're watching Med Talk Health Talk on CNN Philippines. It's hard to decide when, where, and how to have one's disease treated in this time of the pandemic. And this is even more true for cancer patients. I'm Dr. Freddy Gomez. The best thing cancer patients can do to lower the risk of getting the virus is simply to avoid the virus by staying home. Dr. Rosario, what if they have to undergo treatment? What's the best thing to do?
I think the best thing to do is really to talk with your healthcare providers, most especially your doctors, so that you can schedule a time when you can come in where there are not a lot of patients around. Now, we have to always remember that we cannot hold or stop treatment if we have cancer, even if there is the presence of COVID-19 around us, because, cancer will not stop for COVID-19. I guess number one tip is make use of telehealth, telemedicine, teleconsultations, so that you can still be in touch with your doctor or your healthcare provider. Secondly, will be still observe the usual recommendations and guidelines to wear masks, face shields in the Philippines, and to wash hands more often. The same with social distancing. Thirdly, would be to really schedule your visits to the hospital. You need to sleep well, manage stress a little, move around, exercise, and eat well.
But Dr. Rosario, what advice can you give those who still have treatments to go, who are still undergoing cancer treatments, pero ilang silang or concerned sila about their safety whenever they need to get their treatments? What can you advise for them?
The best advice also, I guess, is that we have to remember that the treatments have to go on. We have to find ways where we can go to the facilities and get the treatments with less risk.
And at the end of the day, the best thing you can do to lower your risk of getting cancer is to make healthy choices. Dr. Galang, let's discuss some lifestyle changes that our viewers can make in order to reduce the risk of getting cancer.
The basic ways on how to prevent cancers in general should be to have a well-balanced diet and a healthy lifestyle. Earlier, Dr. Rosario has mentioned several ways on how to protect ourselves. A diet that is high in fiber is protective to the colon. Other foods that are high in fat are considered not at all healthy to the colon. Okay, we should avoid certain vices like tobacco smoking or even drinking too much alcohol. We have to keep ourselves within our normal weight or normal body mass index, or an average weight, if you may call it, because patients who are obese tend to have these comorbidities that would lower down their immune system and then may develop the risk for a higher risk for colon cancer.
And with that, I'd like to thank our guest for today, Executive Director of the Philippine Cancer Society, Dr. Rachel Rosario, and gastroenterologist, Dr. Augusto Jose Galang. Cancer has been around since the early humans, and with technology, our ability to test the disease and treat it has dramatically improved. More and more people with cancer are living longer than expected, and some are in fact being cured of the disease. While there are some things that increase the risk of cancer that we can't change, living a healthy lifestyle will make it less likely. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching.